Okay, we move down to the oral cavity or the mouth. So there are actually two spaces in the mouth. This larger space right here, occupied by the tongue, that is the oral cavity proper. And this small slit-like space outside of the teeth, inside the lips and the cheeks, that is the oral vestibule or the vestibular space. So when our mouth is closed, so the two spaces become separate spaces, no? And the only communication that is retained is at the retromolar region, this space right here behind the third maxillary and mandibular molars. So the roof of our oral cavity is formed by the hard palate. You can see the alveolar process of the maxillary bone right here, where the upper teeth are socketed in. And then the floor is mainly formed by the mylohyoid muscle. The other muscles found here at the floor of the mouth. This one is the geniohyoid, mylohyoid muscle right there, geniohyoid, no? So this is the section hyoid bone, no? And this muscular organ here is the tongue. You can see the alveolar process of the mandible, where the lower teeth are socketed in. So the boundary, no, of the oral cavity from the oropharynx would be the oropharyngeal isthmus, no? So there is a mucosal fold right here, stretching from the soft palate going to the lateral aspect of the tongue. Can you see that one right there? So that mucosal fold, no, which contains muscle, no, that is called the palatoglossal fold. The muscle found, or the muscle embedded in the palatoglossal fold, is the palatoglossus muscle, no, one of the extrinsic muscles of the tongue. So palatoglossal fold. There's another mucosal fold right here, stretching from the soft palate again, lateral to the uvula, going down to the pharynx. That is the palatopharyngeal fold. Embedded in the palatopharyngeal fold is the palatopharyngeus muscle. And you can see there is a lymphoid mass, no, right between the palatoglossal and the palatopharyngeal fold. That lymphoid mass is the Palatine Tonsil, no? That is the famous tonsillar tissue, no, that we examine, no, in the mouth of our patient when patients complain of fever and sore throat and difficulty in swallowing. You can see it right there, no, with the tongue partially retracted. You can see the palatine tonsils right there, just like the tubal tonsil here and the pharyngeal tonsil up here, no? I'm not sure if this was mentioned, no? At the roof of the nasopharynx, there is also tonsillar tissue, which we call the pharyngeal tonsil, no? So they are part of the Waldeyer's ring of lymphoid tissue, no? So the last lymphatic structure, no, completing the Waldeyr's ring will be the lingual tonsils, which are found on the posterior third of the tongue, no? Right here in this area. So this space or area right between the palatoglossal and palatopharyngeal folds, no, we call that the oropharyngeal isthmus, no? Oropharyngeal isthmus. So the isthmus is found in between the oral cavity proper and the oropharynx. That is not part of the oropharynx, nor is it part of the oral cavity proper, no? It is an area, no, of its own. You can see the base of the tongue here. So this flap of tissue right here, no, found at the base of the tongue, no? This is the epiglottis. The epiglottis is an important structure, no, which closes or seals off the air passage, no, from the food passage. So this space right here, this is already the cavity, no, inside the larynx or the voice box. The lateral margins of the epiglottis, we call that the ariepiglottic folds, no? They contain muscles, no? And you can see the vocal folds here. The upper vocal fold is the false vocal cords. It is not involved in voice or sound production. The lower fold is the true vocal cords. So you can see section of the thyroid cartilage right there, and then the cricoid cartilage, no? Anterior part of the cricoid cartilage is right there. So below the cricoid cartilage is already the trachea, and posteriorly below the cricoid cartilage, no, is already the esophagus, no? So this space right here, this is the laryngopharynx, no? Part of the pharynx that is behind the larynx, no? So junction between nasopharynx and the oropharynx will be the uvula, and the uvula and the soft palate up here. Junction between the oropharynx and laryngopharynx would be the epiglottis, no? And the ariepiglottic fold down here, no? That is the posterior pharyngeal wall right there, made up of constrictor muscles of the pharynx. So this space filled with the connective tissue, that is the retropharyngeal space, no? Retropharyngeal space. And that is continuous or part of the prevertebral fascia. So any infection right here in the oral and nasal cavity, no, it can actually spread, no, going down the chest and mediastinum via the retropharyngeal connective tissue space, no? So it is mainly loose connective tissue found right there. So it offers little resistance, no, to the spread of infection, no? Especially if you have pockets of pus, no? When you have infection here in the upper air and upper food passage